Hello everyone, this is Dr. Vijal Modi, Obstetrician Gynaecologist and a Gynae Endoscopic surgeon. Today I am going to give a short talk on what is the basics of Gynae Endoscopy. The Gynae Endoscopy is divided into two parts, the Laparoscopy and the Hysteroscopy. First we will discuss about Laparoscopy. Laparoscopy is a surgical tool which allows the surgeon to look into the abdominal cavity and the pelvic cavity through a small incision, and hence the other name for the laparoscopic surgery is keyhole surgery and minimal invasive surgery. Number one, for the diagnostic tool, it's a very important diagnostic tool for the cases of infertility, for the tubal patency test, and also to diagnose the endometriosis, for which it is the gold standard. Now for the therapeutic purpose, it can be used for each and every gynec surgery possible, namely ovarian pathologies like a cyst, ovarian endometrioma, tubal ligation, tubal hydrosalpinx, uterine fibroids for myomectomies, endometriotic lesion excision, adenomyoma excision, hysterectomies, and many other urogynec procedures. Number one advantage is it is cosmetic because it has very small scars. The vision for the operation is good, so the surgical time is less as well as the blood loss is less, and which leads to a shorter hospital stay and a better recovery. So early mobilization of the patient, so less post-op complications are there. Every procedure has its own advantages and disadvantages. The only disadvantage of the laparoscopic surgery is the learning curve. If the surgeon has expertise in it, then the complication rates are very less. But that learning curve itself is the thing. The second disadvantage in India is the cost, because the instrumentation and everything is cost much higher than the open surgeries. Depending upon the procedure what we are doing, the time may vary, and also it depends upon the surgeon who is operating and his skill set. I feel time is not that an important factor for the laparoscopic surgery, as the incision is less, so the exposure to the outside environment is relatively less. So now I'll tell you something about hysteroscopy. Hysteroscopy is a surgical procedure by which we insert a hysteroscope through the vagina into the uterine cavity to see the normal endometrium or a pathology in the endometrium, on whether the two ostias of the tube are open or not, and to see the shape of the uterine cavity. I would like to conclude by quoting a dictum which states, the bigger the surgeon, bigger the incision. But now with the advancement in the medical technology, that dictum has changed. Smaller the incision, where the surgery is done with finesse, the bigger the surgeon. Thank you.